Greetings. I'm Sydney Berry, a second year pre physical therapy scholar from Memphis, Tennessee, and I'll be doing my presentation on health disparities in the African American community, specifically depression among African American single mothers. For my introduction, I would like to introduce what health disparities are and give a little bit of information about the health disparity I specifically chose. Health disparities are unfair differences in people's health and access to healthcare, often affecting those who face social or economic challenges like poverty, racism, or living in areas with fewer resources. Depression among African American single mothers is a significant health disparity due to the combined effects of racial discrimination, financial hardship, and the stress of raising children alone, which increase their risk of mental health issues. Despite this, many face barriers to care, such as stigma, limited resources, and a lack of culturally competent providers, making it crucial to address these challenges and promote mental health equity. For a little bit of background, historically, African American communities have faced barriers to mental health treatment, including stigma, mistrust of the healthcare system, and a lack of culturally sensitive care. As a result, depression in African American single mothers is frequently underdiagnosed and undertreated. Despite experiencing high levels of psychological distress, many women in this community do not seek or receive the care they need. And single motherhood entails juggling multiple roles, such as caregiver, provider, and emotional support. All this without consistent help, which leads to chronic stress and emotional exhaustion. African American mothers experience higher rates of depression than non Hispanic white mothers, both during pregnancy and after pregnancy. For during pregnancy, African American mothers was experience about a 28% of depression rates versus a 16% for non Hispanic white mothers. And then after childbirth, it's about a 12% rate of depression versus a 7% rate of depression. In a study examining the impact of welfare reform on a sample of 1,602 single African American mothers with children aged 3 to 6.5 years of age, 49% of the mothers were found to have elevated levels of depressive symptoms. So, my problem statement says that African American single mothers face disproportionately high rates of depression. Yet many do not receive the mental health support they need due to barriers such as stigma, financial hardship, limited access to care, and a lack of culturally competent providers. This unmet need for mental health services contributes to ongoing emotional distress and worsens health disparities in already underserved communities. Addressing addressing this issue is essential to improving the well-being of African American single mothers and promoting equity in mental health care. For my analysis, I went and found some things that were specifically named as contributors to stress and what led to depression in a lot of African American single mothers. And in a survey of 319 respondents, the most commonly reported contributors to stress were social and environmental factors, especially lack of financial resources, which 36% of those 319 women said that lack of financial resources were what was causing them so much stress. This was followed by psychological factors, including general stress, which was 18.81%, and parenting related stress, which was 12.54%. Physiological or medical conditions were mentioned less frequently, which was 4%. This explains the sources of depression, according to many single African American mothers. For my recommendations to start solving these issues, I started with increased access to culturally competent mental health services, which that entails partnering with local clinics or telehealth platforms to provide affordable or free therapy sessions led by professionals trained to understand and respect cultural backgrounds. And then a second one for short term, I put provide emergency financial assistance or resources, which entails connecting mothers with programs that offer short-term aid for rent, childcare, or groceries to reduce immediate financial stress. And I think that should be for not it just shouldn't just depend on how much you make a year. Because you could be a single mother making a lot a year and it still be a struggle. For the third one, I put offer flexible counseling options. That entails implementing evening or weekend mental health sessions and child care assistance during appointments to accommodate busy schedules so that mothers will have time to get the help they need, like therapy sessions. So they'll have somebody watch their child while they get therapy and all of that. And then for the last one, I put prioritizing self care, which means like aiming for 7 hours of sleep, exercising, making sure you're eating well, managing your stress and setting boundaries. For the long term recommendations, I have expanding access to affordable mental health care. That entails advocating for policy changes that increase insurance coverage, Medicaid expansion, and funding for community mental health centers in underserved areas. The second one, I put building a strong support network. That entails um, just building a strong family or community around you to help you out with your children so you can get the time to take to yourself and take care of what you need. And then for the third one, I put addressing root causes, which means like if you have a lot of trauma, addressing that, racism and systematic oppression, working towards stopping that. And if you're being stressed because of poverty, working towards getting out of poverty. The impact. So if this is left unaddressed, it can contribute to chronic illnesses, poor quality of life, and even premature death. Single mothers often serve as sole providers and caregivers. Their mental health well-being directly affects their children's emotional development, academic performance, and future health outcomes. If left untreated, depression can worsen over time without treatment, potentially leading to substance abuse, suicide, or other serious health conditions. As untreated depression worsens, it can lead to job loss, housing instability, and reliance on public assistance, further stretching already limited community resources. Which this can also affect your children because mothers are like the center of their child's life. So if your mom's not all together, then it could really mess with your upbringing or your life. Addressing this disparity forces the system to adapt by increasing cultural competence, improving access to mental health professionals of color, and integrating mental health into primary care for better outreach. Depression can make it difficult for individuals to keep up with appointments, medication adherence, or chronic disease management, worsening overall health. And here are my sources.